Hey everybody, Dr. Rayford from Vet Triage. We are continuing through this issue of JAVMA from January 1st, 2016. We are going to be talking about pathology in practice. This is about a goat. So these are some gross images. And by gross I mean macroscopic view of the body and also gross. That's a goat. The goat is 15-year-old, female. She had slow weight loss, anemia for 2 years, and anorexia, more weight loss, lethargy, diarrhea for 1 week, and then respiratory distress for 2 days. The images I just showed you show thickened mesentery nodules of the abdominal wall and large amount of abdominal fluid. The anemia was thought to be due to internal parasitism. The goat was dewormed and also treated with oxytetracycline, and she died en route to Cornell. And this study comes out of Cornell University. Clinical and gross findings: the omentum, abdominal wall, abdominal surface of diaphragm, the urinary bladder was covered with red, tan, firm, smooth nodules, and they extended into the serosal surface of the urinary bladder and uterus. The liver, lungs, myocardium, right kidney had the same nodules throughout the parenchyma. Histopathologic findings include spindle-shaped neoplastic cells arranged in streams and bundles. So in the image here, you can see the histology. On this top view, neoplastic cells from the urinary bladder serosal surface with moderate anisocytosis and anisokaryosis. So just a reminder, if you've watched this channel a lot, you've seen these words before. Anisocytosis means differences in cell size, so various cell sizes, and that typically tells you that there's malignancy there. Normally, cells are homogeneous in their size. And anisokaryosis is differences in nucleus size. And so again, typically that's if they have different size nuclei and nucleoli, it indicates active DNA production replication, which is not normal either. And then the bottom has immunohistochemistry. So the red side here is staining for cytokeratin. This is all positive. And then on this side, also positive for a different stain, vimentin. So immunohistochemical staining for these stains, and there was strong diffuse immunopositivity. So the morphologic diagnosis and case summary was peritoneal mesothelioma with metastasis in a goat. Comments: mesothelioma is an uncommon disease in domestic animals. A recent review of 102 tumors in 100 goats, none of them had a mesothelioma. Mesotheliomas may come from any mesothelial cell-lined surface, including peritoneum, vaginal tunic of testes, the pleura, the pericardium. Primary tumors in any of these body cavities can spread to multiple locations. They are accompanied by extensive serosal serous effusions, secondary to obstructed lymphatics or tumor exudation. This fluid promotes exfoliation and implantation of cancer cells with metastasis, followed by implantation rather than distant metastasis. So let's go over that. So distant metastasis implies that cancer cells are spreading to the body through various routes, either hematogenous, meaning through the blood supply, or lymphatic, so through the lymphatic system. Whereas exfoliation and implantation is different. That's literally the cells exfoliating, so it's being released into the ether and then landing somewhere and then spreading that way, and then the process repeats. It's why during surgeries, if you're worried about cancer spread, and let's say you're removing a tumor on the spleen of a dog, you're supposed to not touch the rest of the surface after touching the cancer, the potential cancer, because you worry about you manually spreading it, which is the exfoliation route that you're talking about here. So you're supposed to either change instruments and lavage and all that stuff, or do that procedure last before you close. And before you close, you change instruments, change gloves, lavage. All right. Invasive mesotheliomas with widespread dissemination has been reported. A definitive diagnosis to rule out carcinomatosis requires histology. Other differentials: adenocarcinoma, uroperitoneum, hypoproteinemia from parasitism. In humans, thoracic and abdominal mesotheliomas are from exposure to asbestos, which also has been reported in dogs. In cattle, congenital association has been suggested. Mesotheliomas of the thorax, abdominal, and pericardial cavities in neonatal calves have been described. Reports of mesotheliomas in goats are rare, but include case reports of 2 abdominal mesotheliomas, 1 thoracic. It also can affect sheep, horses, goats, cats, leopard, rabbits. It's a tumor classified as epithelioid, sarcomatoid, or biphasic. Epithelioid mesotheliomas are composed of polygonal cells and resemble carcinomas. Sarcomatoid mesotheliomas are morphologically similar to fibrosarcomas with bundles and streams of spindle cells. And then biphasic are characterized by both spindle and epithelioid cell populations. The sarcomatoid form is less common in domestic animals than the epithelioid form, but is most consistent with the case described here, based on a large population of spindle-shaped cells that form streams and bundles. Mesothelial, meaning neoplastic and normal, cells co-express markers of epithelial, which is cytokeratin positive, and mesenchymal, which is vimentin positive cells. A small number of neoplasms have this pattern of co-expression, including synovial cell sarcoma, renal cell carcinoma, some meningiomas, ciliary body adenoma, anaplastic carcinomas, amelanotic melanomas, Sertoli cell tumor. Differentiation of mesothelioma from these other cancers is based on location and cellular morphology of the primary tumor. Prognosis is guarded to grave, and intracavitary chemotherapy has been reported. So, interesting case of a pretty scary tumor. So, just a reminder for veterinarians, if you are collecting fluid from the abdominal cavity or pleural cavity, mesothelial cells can look neoplastic when they become reactive, as they are reacting to the inflammation or infection or whatever's going on, and not actually cancer. However, those reactive mesothelial cells may not be reactive, they might be neoplastic, and so you have to investigate thoroughly to know for sure. So if you tap an abdomen or a thorax, and you get suspicion of mesothelioma, you don't want to condemn that animal just yet to the diagnosis of cancer. You need to figure out, well, is this actually mesothelial cells reacting to something else, and it's not cancer, or is it actually cancer? And so you need advanced imaging, for example, and biopsies to figure that out. For pet owners, just realize how complicated cancer diagnosis is for veterinarians, and with papers like this one, for example, if you hear the diagnosis of mesothelioma, you should think, well, how certain is my vet in the diagnosis of my animal? Because it could be that the mesothelial cells are just reactive and not actually neoplastic. All right, guys, we'll see you in the next video. Bye-bye.